Hello everyone, welcome to Digital Health News. We are here at NASSCOM LHIF and we have with us Mr. Srini Mahalingam, Senior Vice President in Healthcare, BU Head, GS Labs GAVs. Thank you so much, sir. Thank you so much for joining us. I heard your session, it was very interesting, and one thing I wanted to ask you about, when we talk about artificial intelligence, what is one particular thing about artificial intelligence that excites you when it comes to healthcare?
Good. Very first thing, first of all, thank you so much. Okay, I think it was a great event, NASSCOM bringing everyone together. When it comes to AI in healthcare, I always keep saying this, it's not the artificial intelligence, it's actually the augmented intelligence, because like any other industry, I am comfortable that somebody else is talking to me over a chatbot and others, right? But in healthcare, I always feel that even though there is an AI element into it, a touch and feel from a doctor, from a nurse, always helps me, right? I feel very comfortable. So my perspective is that AI as an augmented intelligence to make the doctors, the nurses, and the other staff within the healthcare ecosystem to enable them with a better efficiency for them to do the services. Thereby, it's not that we are going to completely replace the clinical fraternity, right? So that, in my mind, is the AI for healthcare.
Absolutely. Like you rightly said, we are not going to replace the medical doctors, the clinicians entirely, but we will help them with the use of artificial intelligence. So how exactly is artificial intelligence going to help them?
Okay. So there are two aspects to it. Again, AI, in my opinion, always is a journey, right? And when it comes to healthcare, people, we always talk about something on the core clinical area of diagnosing the patient's status or giving a personalized healthcare to the patients, etc. But what we tend to forget is there is also a non-clinical aspect within the healthcare, which is to take care of the operational aspect. Right? And in the journey, I personally, and at GS Lab GAVs as an organization, we see this with a lot of our healthcare customers is, first, focus on the operational aspect and see how AI can help eliminate a lot of inefficiency in the system. Thereby, now the clinical staff get a lot more bandwidth to spend a quality time with the patients and then move into the medical aspects. Right? I'll give you an example. Now, there is a good amount of delay that happens during the discharge. I mean, everybody in the world sees that, right? Why is that happening? Because we are not able to effectively communicate between the hospitals and the payers, the insurance companies. And then we are not able to predict whether the patients can be discharged today or so. And we are not able to effectively communicate between different departments within a hospital, right? All this put together delays the discharge for a patient, and it's a real pain that everybody sees in the today's world. Can AI be implemented which can exactly say that this particular patient is ready for discharge tomorrow? So it should predict the previous day and then line up every communication and send the data to insurance well ahead automatically, get the approvals, etc. So by 10 a.m., if a doctor says that patient is ready to go, 11, you should be out of the hospital. So that, in my mind, will have a real impact for the patients.
So improving efficiency within the hospital operations, that is where artificial intelligence will help. Absolutely. How at GS Labs GAVs you are incorporating artificial intelligence into your products and solutions?
Yeah. So whatever I touched upon now about the operational aspect and the clinical aspects, we do work with a lot of our healthcare customers. They are providers, which are hospitals or payers, the health insurance companies, or the life sciences pharma. So a couple of examples that I can say. One, the operational side, we work closely with one of our big pharma customer to help eliminate a problem that they are facing in their supply chain management. So their medicines are to travel to the entire world from a warehouse that they have within the US, right? And in the process, what happens is they have to ship that, to a destination. And when it reaches, it should not be expired. It should be active with the ingredients. And in the event of not missing the deadline, they were actually taking the easier route of shipping them through the flight. whereas they have lost millions and millions of dollars in the course of that, right? So we developed an algorithm for them which helped them to actually say that instead of shipping them through air, you can also ship them through ocean. And what are the constituents of that pharma, the final component can be used for that. And this project itself is called Air to Ocean. And our algorithm helped them to segregate a major part of their components that can be shipped through ocean, right? This helped them really, really well. And I can keep talking. There are a lot of clinical aspects that we do, like predicting the hospital-acquired infection, etc. And it's a journey, as I said, right? They are bringing more use cases and challenges to us, and we are in the journey of implementing AI for them.
Absolutely. Thank you. Thank you so much.
Thank you so much for this opportunity.